Welcome to Kathryn Raaker's World. Innovation, culture, adventure, fashion and health, artists, destinations, traditions. This is Kathryn Raaker's World.
Hi, this is Kathryn Raaker of Kathryn Raaker's World, our syndicated TV show, and Let's Just Talk, our syndicated radio show. You know, each year, millions of people in America are prescribed a medicine for acute pain. Now, for the first time in 20 years, the FDA has approved a non-opioid pain treatment that offers an effective and well-tolerated option without the addictive potential of opioids. Joining us today is Dr. Todd Bertoch, Chief Medical Officer for Pain Research at CenExel, Principal Investigator at CenExel Utah for Journex, and Vertex Pharmaceuticals Acute Pain Steering Committee member. He'll discuss the significance of this new medication and how it works and what it could mean for the future of acute pain management. Welcome to our show, Doctor. How are you today?
I'm doing well. Thank you for having me.
This is very exciting because, so many people are put on opioids, and they can't get off and things aren't the greatest. So can you explain what acute pain is for my listeners and viewers and who is affected by it?
Yeah, acute pain is defined usually as some pain that kind of develops spontaneously and lasts for less than 3 months. Differentiates from chronic pain, which is defined as something that persists for longer than 3 months. So examples of conditions that might lead to acute pain, you think of surgery, burns, broken bones, sports injuries, things like that. So it's a pretty universal experience. I think most of your listeners, viewers have had some experience with acute pain at some point in their life.
Well, we just went through it with my husband, so I can, and he got off of the opioids really fast and onto Tylenol or something else. So it was good. So, and he had extensive surgery, doctor. So for those experiencing moderate to severe acute pain, are there any new options that can help manage their condition?
Yeah, there are. In fact, as you mentioned, for the first time in more than 20 years, FDA has approved medication from a new class of medicines to treat acute pain. The drug's called Journavx. It acts in the peripheral nervous system, so it blocks the transmission of pain signals in the peripheral nervous system before they ever get to the brain. The receptor that it acts upon doesn't exist in the brain, so it doesn't have those same addictive potential or side effects that other medications like opioids that act in the brain have. It does have side effects like most drugs do. It can cause itching, rash, muscle spasm, things like that. There are some drug-drug interactions that can happen. So patients should definitely talk to their doctor before using the medication, make sure it's right for them. But the studies have shown that it's comparatively a really safe and effective medication. So as you mentioned, really exciting new development.
Well, who might benefit from Journex? And I can imagine that a lot of orthopedic surgeons and surgeons that are working on all kinds of other things in surgery would really appreciate having not to put their patients on opioids. Am I correct?
You're exactly right. Yeah. So right now it's approved by the FDA for patients suffering from moderate to severe acute pain that are adults. And as you mentioned, prescribers, orthopedic surgeons, other prescribers that are treating acute pain are really kind of stuck. It's, there are people who the traditional medications for acute pain like NSAIDs, acetaminophen, just aren't enough, right? And so their next step is to prescribe them an opioid. And this kind of bridges that gap and allows us to maybe push that down the road a little bit and only prescribe opioids to people who are having more severe pain. So it's a really exciting option for, me as a prescriber and someone who does research in this field to have another option. Anytime, a doctor can write a prescription for acute pain that's not an opioid, I think that is really a step in the right direction.
And usually, how long are they on it?
Yeah, so
after surgery.
again, it's approved for acute pain, so it's not designed to be used for a long period of time. And most people, as you mentioned, that happened with your husband, most people after a short period of time will be able to transition to some of the over-the-counter pain medicines. So again, not designed for chronic treatment, but definitely approved for acute pain therapy.
This is really exciting. I can't believe it. I'm so excited about it. Why is the approval of this medicine so important right now? I mean, I know the answer, but let's hear it from you.
Yeah.
I think that's
Yeah,
important.
every year in the US, about 80 million prescriptions are written, or 80 million patients are prescribed something to treat their acute pain. About half of those prescriptions are for opioids. And a really surprisingly large percentage of those patients actually go on to develop opioid use disorder. It's a significant problem. Some studies have shown, up to 85,000 patients a year that develop opioid use disorder after being prescribed an opioid for acute pain. So, as we mentioned, being able to not prescribe an opioid and not have to, risk that is incredibly important for the opioid crisis, and in the U.S. and across the world, really.
Wow. And where can we learn more about this new FDA approved prescription?
Yeah, people can go to journavx.com. A lot of information that they're going to be looking for is there on that website. And of course, talk to your doctor, make sure this is right for you. But I think your doctor might be as excited as I am to have this
I'm gonna
new
let you know.
potential prescription. Yeah.
So my brother and my daughter are both OTs and work with orthopedics. And so they're going to be very excited. And so are the Beacon people. So they'll love to hear all of this. Thank you so much for what you're doing. And I wish you the best of everything. And thank you so much for joining me today. Give that website out one more time, Doctor.
Yes, journavx.com. Thank you so much.
Thank you, and have a great day. And don't forget to go
You
to
too.
our website at Kathryn Raaker's World, and let's just talk. See you soon.